Inflammation in the gut. Causes, symptoms, and treatment. Inflammation in the gut, also known as gastrointestinal inflammation, is a complex condition that affects millions of individuals worldwide. It involves the immune system's response to various triggers, leading to inflammation within the digestive tract. In this video, we will explore the causes, symptoms, diagnosis, and treatment options for gut inflammation, shedding light on this prevalent health issue. Causes of gut inflammation. Inflammatory bowel disease, IBD. IBD is a group of chronic inflammatory conditions that primarily include Crohn's disease and ulcerative colitis. The exact cause of IBD is unknown, but it is believed to involve an abnormal immune response triggered by genetic and environmental factors. Irritable bowel syndrome, IBS. Although IBS is not characterized by structural changes in the gut, it can cause inflammation and disrupt normal bowel function. Triggers for IBS inflammation can include stress, certain foods, and imbalances in gut bacteria. Infections. Bacterial, viral, and parasitic infections can lead to gut inflammation. These infections can result from consuming contaminated food or water, and they may cause acute or chronic inflammation in the gastrointestinal tract. Food sensitivities. Some individuals may experience gut inflammation due to specific food sensitivities or allergies. Common culprits include gluten, lactose, and certain food additives. Autoimmune reactions. In some cases, the immune system mistakenly targets healthy cells in the gut, leading to chronic inflammation. Conditions like celiac disease and autoimmune enteropathy fall into this category. Diet plays a significant role in gut health and inflammation. While trigger foods can vary among individuals, certain dietary factors have been associated with increased inflammation in the gut. These include processed and refined foods. Highly processed and refined foods, such as sugary snacks, processed meats, and packaged foods, often contain additives, preservatives, and artificial ingredients that can trigger inflammation in the gut. High intake of saturated and trans fats. Consuming excessive amounts of saturated and trans fats, commonly found in fried foods, fatty meats, and processed snacks, has been linked to increased inflammation. Excessive sugar consumption. A diet high in added sugars, such as sugary beverages, sweets, and processed snacks, can promote inflammation and negatively affect gut health. Gluten and wheat. For individuals with gluten sensitivity or celiac disease, consuming gluten-containing grains like wheat can trigger inflammation in the gut. It is essential for these individuals to follow a gluten-free diet. The gut-brain connection. The gut-brain connection refers to the bidirectional communication between the gut and the brain. The gut has its own nervous system known as the enteric nervous system, often referred to as the second brain. This intricate network of neurons in the gut communicates with the central nervous system and influences various aspects of brain function, including mood, emotions, and stress responses. Research suggests that disturbances in the gut microbiota and gut inflammation can contribute to alterations in the gut-brain axis, leading to conditions such as irritable bowel syndrome, IBS, and even mental health disorders like anxiety and depression. Stress and psychological factors can also impact gut health and contribute to gut inflammation. Understanding and addressing the gut-brain connection is crucial for comprehensive management of gut inflammation. Techniques such as stress management, mindfulness practices, and cognitive behavioral therapy can help reduce stress levels and positively impact gut health. Holistic approaches and complementary therapies. In addition to conventional medical treatments, some individuals with gut inflammation may explore complementary or alternative therapies to support their overall well-being. While scientific evidence for these approaches is limited, some people find them beneficial in managing symptoms and promoting gut health. These therapies may include herbal remedies. Certain herbs and botanicals, such as aloe vera, turmeric, chamomile, and peppermint, have been traditionally used to support gut health and reduce inflammation. However, it is important to consult with a healthcare professional before using any herbal remedies, as they may interact with medications or have adverse effects. Acupuncture. Acupuncture, an ancient Chinese therapy involving the insertion of thin needles into specific points on the body, is believed to help restore balance and promote healing. Some individuals find acupuncture helpful in managing gut inflammation symptoms. Mind-body practices. Techniques like yoga, meditation, tai chi, and deep breathing exercises can help reduce stress, promote relaxation, and potentially improve gut health by modulating the gut-brain axis. Symptoms of gut inflammation. Symptoms of gut inflammation can vary depending on the underlying cause and severity of the condition. However, common signs and symptoms include abdominal pain and cramping, diarrhea or constipation, persistent bloating and gas, blood in the stool, nausea and vomiting, weight loss or poor appetite, fatigue and weakness, fever in cases of infection-related inflammation. Diagnosis. Diagnosing gut inflammation involves a comprehensive evaluation of medical history, physical examination, and various diagnostic tests. These may include blood tests, assessing blood markers for inflammation, infection, and nutrient deficiencies. Stool tests, analyzing stool samples for signs of infection, inflammation, or other abnormalities. Endoscopy, using a flexible tube with a camera to visualize the gastrointestinal tract and obtain tissue samples for further examination. Imaging tests, X-rays, CT scans, or MRIs may be performed to assess the structure and condition of the gut. Food allergy testing, identifying potential food triggers through allergy tests or an elimination diet. Treatment options. Medications. Depending on the underlying cause and severity of inflammation, healthcare professionals may prescribe anti-inflammatory drugs, immunosuppressants, antibiotics, for infections, or medications to manage symptoms such as pain and diarrhea. Dietary changes. Eliminating or reducing trigger foods, following a low FODMAP diet, or implementing a specific carbohydrate diet, SCD, can alleviate symptoms and reduce inflammation for some individuals. Probiotics. Certain strains of beneficial bacteria, known as probiotics, can help restore gut microbial balance and reduce inflammation. They may be consumed as supplements or found in fermented foods like yogurt and sauerkraut. Stress management. Stress reduction techniques such as mindfulness meditation, exercise, and therapy can be beneficial for individuals with stress-induced gut inflammation. Surgery. In severe cases of gut inflammation, surgical intervention may be necessary, particularly for individuals with complications such as strictures or perforations. Complications of gut inflammation. If left untreated or poorly managed, gut inflammation can lead to several complications, including nutritional deficiencies. Chronic inflammation in the gut can interfere with nutrient absorption, leading to deficiencies in vitamins, minerals, and other essential nutrients. This can result in weight loss, fatigue, and an increased risk of other health problems. Intestinal strictures. In conditions like Crohn's disease, chronic inflammation can cause the intestinal walls to thicken and narrow, leading to the development of strictures. Strictures can obstruct the normal flow of food through the digestive tract, causing abdominal pain, bloating, and potentially requiring surgical intervention. Fistulas. In some cases of gut inflammation, abnormal connections, fistulas, may form between different parts of the digestive tract or between the intestine and other organs. Fistulas can cause severe pain, infections, and complications that may necessitate surgical treatment. Increased cancer risk. Individuals with long-standing inflammation in the gut, particularly those with inflammatory bowel disease, have a higher risk of developing colorectal cancer. Regular monitoring and screenings are recommended for early detection and intervention. Impaired quality of life. Gut inflammation can significantly impact an individual's day-to-day life, leading to disruptions in work, social activities, and overall well-being. The chronic nature of certain conditions can cause emotional distress, anxiety, and depression. Lifestyle modifications for gut inflammation. Alongside medical treatments, incorporating certain lifestyle modifications can help manage gut inflammation and promote gut health. Maintain a healthy diet. Focus on consuming a well-balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Avoid trigger foods that exacerbate symptoms, such as spicy foods, caffeine, alcohol, and high-fat or greasy foods. Stay hydrated. Drink an adequate amount of water throughout the day to support digestion and prevent dehydration, which can worsen symptoms. Manage stress. Chronic stress can contribute to gut inflammation. Engage in stress-reducing activities such as regular exercise, yoga, meditation, deep breathing exercises, or pursuing hobbies to promote relaxation and well-being. Regular physical activity. Regular exercise has been shown to have a positive impact on gut health. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Get enough sleep. Prioritize sufficient sleep to support overall health and reduce stress levels. Aim for 7 to 8 hours of quality sleep each night. Avoid smoking. Smoking has been linked to an increased risk of developing Crohn's disease and worsening symptoms in individuals with inflammatory bowel disease. Quitting smoking can have a significant positive impact on gut health. Potential future treatments for gut inflammation. Researchers and scientists are continuously exploring new approaches for treating gut inflammation. Some potential future treatments under investigation include microbiota-based therapies, manipulating the gut microbiota through methods like fecal microbiota transplantation, FMT, or the use of targeted probiotics may help restore microbial balance and reduce inflammation in the gut. This approach is particularly promising for conditions like Clostridium difficile infection and certain forms of inflammatory bowel disease. Biologic therapies. Biologic drugs, such as monoclonal antibodies, target specific molecules or immune pathways involved in gut inflammation. These medications can help modulate the immune response and reduce inflammation. Biologics have shown success in treating inflammatory bowel disease and may have potential applications for other gut inflammatory conditions. Stem cell therapy. Stem cells hold promise in regenerative medicine and tissue repair. Researchers are exploring the use of stem cell therapy to repair damaged gut tissue and promote healing in conditions associated with gut inflammation. Targeted drug delivery systems. Developing innovative drug delivery systems that can specifically target the inflamed areas of the gut may enhance treatment efficacy while minimizing side effects. These delivery systems could include nanoparticles, hydrogels, or coatings on oral medications. Nutraceuticals. Certain natural compounds, such as curcumin, omega-3 fatty acids, and butyrate, have shown anti-inflammatory properties and may have therapeutic potential in managing gut inflammation. Research is ongoing to further investigate their effectiveness and optimal dosages. The future of gut inflammation research. Gut inflammation is an area of active research, and scientists are continually striving to deepen our understanding of its causes, mechanisms, and treatment options. Some of the key areas of ongoing research include gut-brain axis, investigating the bidirectional communication between the gut and the brain and how it influences gut inflammation and related conditions, including irritable bowel syndrome. Genetic factors, exploring the genetic factors that contribute to an individual's susceptibility to gut inflammation, with the goal of developing personalized treatment approaches. Environmental triggers, investigating the impact of environmental factors, such as diet, pollutants, and lifestyle choices, on gut inflammation and identifying strategies to mitigate their effects. Microbiome research, continuing to unravel the complex interactions between the gut microbiota, the immune system, and gut inflammation, which may lead to novel therapeutic approaches. Biomarkers, identifying reliable biomarkers to aid in the early detection, diagnosis, and monitoring of gut inflammation and its progression. By advancing our understanding of gut inflammation through ongoing research, it is hoped that new and more effective treatments will emerge, offering improved outcomes and quality of life for individuals living with these conditions. Conclusively, inflammation in the gut is a complex condition that can significantly impact an individual's quality of life. It can arise from various causes, including autoimmune reactions, infections, and food sensitivities. Recognizing the symptoms and obtaining an accurate diagnosis is crucial for effective treatment. With proper management, including medications, dietary changes, and lifestyle modifications, many individuals with gut inflammation can find relief and lead healthy lives. Subscribe to my YouTube channel, like and share the video to your friends and loved ones. Subscribe to my YouTube channel, like and share.